Let's talk about that deep, nagging pain on the side of your hip. The kind that just seems to hang around forever. Well, today we're digging into a really interesting little study from 2015 that looked at a surprising way to potentially treat it. It's such a common question, right? You feel like you've done everything. You've rested it, you've stretched, you might have even tried a bunch of other treatments. But that annoying ache on the outside of your hip, it just comes back. And that is the most frustrating part. Things that are supposed to work, like standard physical therapy or even injections, they might give you a bit of relief for a while, but it often doesn't stick. And that's exactly why researchers are always on the hunt for different approaches. Okay, so let's get specific about the exact problem this study was trying to solve. We're talking about a really particular, really stubborn kind of pain. Doctors often call it greater trochanteric pain syndrome. But for most people, it's just that relentless ache on the outside of the hip that sometimes travels down the thigh. The study points out that it's especially common for women in their 40s and 50s. And this is no small thing. It can totally mess up your sleep, especially if you're a side sleeper, and it can make even a short walk feel like a marathon. So, faced with this really common and frustrating problem, the researchers in this study decided to test out a technique you may have heard of, dry needling. Now, you might be thinking, oh, so it's like acupuncture? And it's in the same ballpark, but the philosophy behind it is different. A physical therapist takes the super thin, solid needle, and the dry part means there's no medicine or injection, it's just the needle itself, and inserts it into tight bands of muscle or tissue. The whole idea is to get those problem spots to release, which can lead to less pain and better movement. Now, here's a really, really important detail. The study didn't just look at dry needling by itself. It was more of a 1-2 punch. First, the therapist would do the needling for about 15 minutes, and then the patients also did a regular program of stretching and strengthening exercises. So the dry needling was an add-on to standard physical therapy, not a replacement for it. All right, so how did they actually set this up? How did they test this combination approach? This is what makes this study so compelling. They took 4 people who were basically at the end of their rope. They all had this chronic pain, and they'd already been through the ringer with other treatments, things like steroid shots and traditional PT that just didn't provide any lasting relief. They were the perfect people to test this on. So to figure out if it was actually working, they needed a way to measure the change. They used 2 main tools. The first is called the Lower Extremity Functional Scale, or LEFS. It's basically a survey that asks how well you can do things like walk, run, or climb stairs. For that one, a higher score is better. The second is the Visual Analog Scale for pain. You've probably seen it. It's just a line from 0 to 100 where you mark how bad your pain is. And for that one, obviously, a lower score is what you're hoping for. Okay, so they had the people, they had the treatment, and they had the measurements. What happened? Well, the results were pretty remarkable. Let's start with pain, because that's the big one. On that 100-point scale, the average score for their worst pain before treatment was an 85. That is really high. After the treatment, it dropped all the way down to 32.5. Just look at that change on the chart. That's not just a little improvement, that is a massive, life-altering drop in pain. A reduction of over 50 points meant these people were experiencing way, way less suffering in their day-to-day lives. But it wasn't just that their pain got better. Their ability to actually do things improved dramatically, too. Their average function score jumped from about 51 to almost 67. Now, a 16-point jump might not sound like a huge number, but in the world of physical therapy, that's a really big deal. Just a 9-point improvement on this scale is considered a clinically significant change. These folks saw a 16-point jump, which means a real, tangible improvement in their ability to just live a normal life. And you don't even have to take my word for it. This quote from the study pretty much says it all. The numbers are one thing, but this is what it really means. People were sleeping better, they could walk farther, and they could get through their day with much less trouble. The data really translated into a better quality of life. And here is the real kicker. This wasn't just some quick fix. When the researchers followed up with these people about a year later, on average, the benefits had stuck. Their pain was still down, and their function was still up. For a group of people who had tried so many things without any lasting success, this was huge. Now, as incredible as all this sounds, we have to take a step back and put it all into context. It's really important to look at this with a critical eye. The researchers themselves are very upfront about the study's limitations. First, and this is the big one, it was only 4 people. That's a tiny sample size. Second, there was no control group, so they didn't have another group of people who only did the exercises without the needling. That means we can't be 100% sure if it was the needling, the exercises, or the specific combination of the two that made the difference. This kind of study is called level 4 evidence. You can think of it like a really promising lead in a detective story. It's not enough to solve the case, but it tells you exactly where you need to investigate next. And so that leads right into their main conclusion. This little experiment suggests that adding dry needling to a physical therapy plan could be a fantastic option for this kind of stubborn hip pain. But to really prove it, we need much bigger studies with more people and proper control groups. So it leaves us with this really powerful thought. This study wasn't about testing one thing versus another. It was about testing one thing plus another. And maybe that's the real takeaway here. For some of these really tough chronic pain conditions, maybe the future isn't about finding one single magic bullet, but about finding the right combination of therapies that work together.